All right. Good morning, everybody. Dr. Rafich here, Vet Triage. It is 10:32 a.m. Pacific time, and we are going to talk about referrals. This may not seem like a big deal to a lot of folks, but when it comes time to needing a specialist, this will become a big deal. And especially nowadays where it's hard to find veterinarians in general, they're booked out for, weeks or months or indefinitely. You live in an area that's kind of remote. And so, I think the live stream may have just restarted. So I'm just going to restart again. Freaking YouTube. So I'm Dr. Arafij, Vet Triage. It is September 3rd, 10:32 a.m. Pacific time. We're going to talk about referrals to specialty. This may not seem like a big deal to most pet owners because they have never needed a specialist. However, when the time comes that you need a specialist, this is really important for you. And it's especially important nowadays with the limitation on veterinarians, like access to vets, because these veterinarians, especially specialists, are booked out for weeks, months, or indefinitely. So it's hard to get in. And when you do get in, it's also very, very expensive. And so you want to be prepared ahead of time to decide, schedule-wise, and also in regards to finances, like what you want to do with your pet. But the first step is getting referred to a specialist. So there's pretty much two ways you can do it. The ideal way, I would say, is an actual referral from your family veterinarian or another specialist, but typically your family veterinarian, because then the family veterinarian, your regular vet, can call the specialist, go over the case with them or with their staff, with their team, and make sure this case is appropriate for referral. Make sure that they prepare you, the pet owner, for the referral. Find out what diagnostics they want done ahead of time, what diagnostics they do not want ahead of time, what treatments should they do or not do before the referral. All those details that are important for the intricacies of the case can be discussed over the phone with your regular veterinarian and the specialist. And it may help with scheduling. If you're a long-time referral to the specialist, they may squeeze you in a bit easier if you have a good relationship, if your regular veterinarian has a good relationship with the specialist. So it's worthwhile getting your family veterinarian to refer you directly. The other benefit to that too is record transfer. So you want your medical records transferred to your family veterinarian or from the family veterinarian to the specialist. So if your regular vet refers you, they can send over all the x-rays and blood work and examination notes. Everything can be sent over directly from the source and in preparation for the appointment. And so that's the best way to do it. That's the ideal way of doing it. The other way of doing it, which is a bit different than human medicine, because in human medicine, you need the referral. Otherwise, it won't take you. You have to, in veterinary medicine, you have the option of just contacting the specialty hospital yourself. Now, you're not going to get that, you're not going to get the specialist on the phone with you as a pet owner, and you're not going to be able to dive into your case details the way a doctor would, doctor to doctor. But you can bypass the referral process if you need to and make the appointment with the specialist yourself. Again, it may be hard to get appointments sooner, have them squeeze you in. You're going to want access to your records and then send them records over yourself, which, not everybody is tech savvy, and some regular veterinarians are very slow to send you the records to be sent over and all that. And then the other problem is, some regular veterinarians get offended by the pet owner referring themselves to a specialty hospital, right? Because maybe you're being referred to the specialist by your regular veterinarian, or maybe you're getting second, third, fourth opinions, not finding an answer, and then you discover, oh my goodness, wow, there's a neurologist that I can see, and then you make the appointment directly with them. So there is this little bit of a public relations PR aspect to this, where pet owners feel bad that they're circumventing the regular vet. The regular vet feels offended that that their client is, going behind their back to be referred. But at the end of the day, you are your pet's advocate. And so if you feel as though that the specialty route is the best way, and your vet is being possibly difficult about it or not as proactive as you'd like them to be, you could actually call a specialty hospital yourself and book your own appointment with them. So, pros and cons to either method. The final way, the third way of doing it is through vet triage. If you have a live video chat with a veterinarian on vet triage, they can help decide whether or not you need specialty care. Is it a scenario where it's an emergency and we can't wait for specialty care? Or maybe there's a facility that we have partnership with where we can get the pet owner seen, the pet seen by the specialist, maybe not that night. Let's say it's like a Sunday night, but if we get them admitted Sunday night, they can maybe be seen Monday morning, something like that, by the specialist Monday morning. So there's ways that vet triage can kind of finagle things too, because we have great relationship with veterinary clinics, and a lot of them are very large 24/7 emergency multi-specialty hospitals. So yeah, so there's your basically your three ways actually of seeing a specialist as a pet owner. And I hope that helps. Again, this video would be more useful to folks who have this concern, who are in this boat. Those who don't may not find that useful, but it is good information to know, because you may, not always, but you may find yourself needing a specialist at some point with your pet, especially if you own a lot of animals, and this information will be invaluable to you. By the way, as a side note, for general practices, please help the specialist out. Send the records over in a timely fashion. You can even have your office follow up with the client like the day before to confirm that they are still going to honor that appointment with the specialist. The specialist team usually will contact the client the day before as well to make sure that we have all the records, make sure that they have confirmation that the appointment is still happening, because these specialists are in demand, and I guarantee you they have a wait list of people that will jump on your appointment if you don't show up, or you forget, or whatever it is, or you're late and they say, sorry, you're late, we took another patient or whatever. So it all works when everybody is working as a team. So the GP, the general practice, should make sure that the client is set up appropriately. The specialist is going to have what they want, what they need, and then records are sent over in a timely fashion. The specialist needs to be upfront with the general practitioner for what they need, as far as diagnostics and medical records, and setting the client expectations. And then, of course, following up with the client the day before the appointment to make sure that we have confirmation. And the pet owner has to be, receptive to the fact that specialists are very nuanced in their experience, what they're here for, and that there's going to be a price tag with that. But you also have a spectrum of care. The consultation is the first step, and maybe it ends there, or maybe your relationship with the specialist progresses to where they're performing, surgery on your pet or whatever. So pet owners need to be open-minded about what the specialist is going to talk about and all that. So yeah, so I think that's it for this video. I hope that helps. Thanks for those who are watching the playback. Feel free to subscribe, like, all that good stuff. And I'll see you guys tomorrow, Wednesday, September 4th, for another live stream. Bye.